name is Marie Hodges. I've been a nurse here at Baylor St. Luke's for about 4 years now. My specialty was cardiovascular. I was on 10 Tower for 2.5 years, and then I moved to cath lab for 8 months, and now I'm in radiology. And radiology is never something I really thought I would love, but I absolutely do. And interventional radiology itself has many details and outlines that not every nurse knows, particularly those that are new to the hospital setting. So I'd like to go over those with you today in a series of short videos where we visit all of the departments of radiology, and I get to give you some more information about each of them. The 7 or 6 departments of radiology are CT scan, ultrasound, angio or interventional radiology, neurointerventional radiology, MRI, and nuclear medicine. What I'm going to be giving you today in this introductory video is the most important part, though, because it's just the generic information that you should know when you're sending your patient to a radiation scan or a procedure in interventional radiology. So when you are first sending a patient to this scan or procedure that you're doing, the first thing that I want you to do is to check their allergies. Do they have an allergy to shellfish, iodine, or contrast dye? If they do, and if they've had a reaction to that dye in the past, I need you to contact their doctor for an order for prep. That prep is usually about 16 to 8 hours beforehand and consists of steroids and Benadryl, which is something we need to know before they come down for their scan. The second thing I want you to do is to check the patient's labs. I want you to look at their creatinine level, which will give me a good indication of how well their kidney function is doing. I don't want to interfere with that with contrast dye too much. And their coagulation, which will show me how well that patient's blood is clotting. If we do an invasive procedure, I want to make sure that they're not going to bleed out afterwards. The last lab I want you to check is if they are a female between the ages of 12 and 55, I'll need a pregnancy test before we put them under any type of radiation. The reason for this is, of course, pregnancy and radiation don't go well together, and I don't take people's word for it that they're not pregnant. I will need a pregnancy test before we send them to a scan or a procedure in interventional radiology. The last and most flexible guideline in radiology is the NPO status. Typically, if they're having an invasive procedure that requires sedation, they need to have nothing to eat or drink for 4 hours prior to the scan. Sips of water with meds is okay. Thank you for watching this segment of the video. We will move on to our next part of the tour. Hi, I'm standing in the CAT scan department here at Baylor St. Luke's Medical Center. CAT scan stands for computed tomography. So what that means is this circular machine behind me is a circular x-ray that sends revolving images to the computer. That's why it's called computed tomography, CAT scan. We have 3 scanners here at Baylor St. Luke's Medical Center. This scanner over here is for ER and ICU patients most of the time. Scanner behind me is for CT-guided procedures such as lines, drains, and biopsies. And the one where I'm standing here is used for scans as well as coronary artery scans. That's one of its specialties. So the basic things to remember about CT scan is that it falls under the same radiation guidelines that I went over at the beginning of the talk. So check your allergies to iodine and contrast specifically for this one. Check your labs. And if it is an invasive procedure, they will need to have nothing to eat or drink for 4 hours before. The most important thing, though, is whether it's a scan or an invasive procedure, is you see this long arm over here from the ceiling coming down? That is a power injector for contrast for a CT scan. It injects at 5 milliliters per second, which is why they have the requirement of a 20 gauge IV or larger in a large vein in the upper arm for them to inject contrast to do the scan. A central line will work as well. For those of you who work with cardiac patients, you'll know that a CTA cardiac is a specific type of scan where we will need their heart rate to be between the 50s and the 60s. And if it's not there naturally, we will need you to lower it artificially using blood pressure drugs and an order from a doctor. The reason for that is that this CT machine will scan between heartbeats, so I need their heart rate to be nice and low. And that's about all I could say at CT. Thank you. We are in the Baylor St. Luke's Medical Center Ultrasound Department. Now, ultrasound technology uses this machine and uses microwave technology to send sound waves through tissue. those sound waves bounce off the tissue and gives us very specific images of either tissue or fluid. So typically what we do in this department is we either drain fluid, either like a one-time where we leave a drain in, and biopsies of large organs such as the liver and the kidney. We can also place chest tubes, paracentesis, thoracentesis all fit into this category. There is no radiation involved in the ultrasound department. The most important thing to remember about sending your patient to an ultrasound scan, particularly an invasive one, is what their labs are that day. We will always be looking at their platelet level and their PT-INR to see how fast they're clotting and how well their body can clot. To get to the ultrasound department, you'll take the purple elevators to B1 and make a left. It'll be on the left side of the hallway. Typically, if you were in the ICU, you'll have a mobile ultrasound unit that'll come to you, and very rarely will floor nurses need to come to ultrasound. Thank you. Here we are in the interventional radiology department at Baylor St. Luke's Medical Center. Interventional radiology itself has many different names, including angio, interventional radiology or IR, main, or body. So this department is really the basics of what we do here. It's invasive procedures and our X-ray imaging. Behind me, suspended from the ceiling, you can see is the X-ray table that the patients would lay on, and then this is a biplane X-ray that would scan over where the physician is working at. And those images are conveyed on the screens as well as over here in our control room. So the procedures that we do down here is, well, I like to think of us as the fixers. If you have something to fix, we fix it. So if you need a line place that you can't place on the floor, a dialysis catheter, a port, if you have a pseudoaneurysm in your groin that we need to embolize or some other sort of bleeding such as GI bleeding, we embolize that as well. We do weird cancer treatments, to be frank with you, whether that's liver cancer or kidney cancer. Really, the crux of what we say when we're sending a patient to IR is this whole suite right here. Now, the restrictions for this department before you send your person down is really the same as what I went over in the introductory video when you're sending someone down to undergo radiation. I'll need that pregnancy test, I'll need the labs to be correct, NPO status because they'll be under moderate sedation most likely, as well as double check their allergies. The moderate sedation part is sometimes important because sometimes patients think that they will be all the way knocked out under general anesthesia for these procedures when that is not the case. Moderate sedation is a combination of Versed and fentanyl. You typically don't feel anything, you typically don't remember anything. So that's also something very important to remember about IR and the reason why we don't have them eat prior to being down in one of our suites. When your patient comes down here, we put them in a holding area that is about 8 beds long. We don't really have access to the Pyxis medications that you folks do on the floor, or food, or really even bathrooms for our patients. It's really just meant to be a quick holding area where we can get them in and get them out quickly. So keep that in mind as well when you're sending your patient to IR. Thank you so much for watching this video. Welcome to the Neurointerventional Radiology Department at Baylor St. Luke's Medical Center. This is the department that does minimally invasive procedures under radiation that involve the brain. So in this procedural area, we work on things like strokes, seizure mapping, and we fix things like brain bleeds, arteriovenous fistulas in the brain, and cerebral aneurysms. One of the ways we do that is outlined for me behind here on this wall. As you can see over here in the poster, typically just like the cath lab, we'll run a catheter up through the patient's groin all the way to their brain, and we're able to fix structural deformities in the brain from that point. For example, aneurysms in the brain are all circular, and this diagram right here shows how we can coil them to make sure that they're no longer a problem for people. The reason why I'm paying so much attention to this poster is when you see this poster, you know you're extremely close to the neurointerventional radiology department. It's right across the hall. So you'll take the yellow elevators down to B1 if you're from the floor, or if you're from the ICU and coming from the purple elevators, take it down to B1, go all the way down to the end of the hallway, square, come all the way this way. Across from these posters is the entry into this department. We'll walk into this department and I'll talk about the further restrictions that we have before sending your patient to these procedures. First of all, I'd like to brag about our neurointerventional radiology department a little bit here at Baylor. We have about 90 minutes from the minute a stroke patient hits our emergency room doors to getting them back here and on the table. At Baylor St. Luke's, our average is closer to 20 minutes. This is achieved with the help of a really professional and great team. I'm on it, as well as about 5 other nurses and 4 other techs. We have one great team of doctors that leads us. And one of the ways that we can help achieve that fast time is that most of you know how to identify stroke. We use the acronym FAST, facial drooping, the arms, the speech, and the most important thing to remember about the time is the time the patient was last seen normal. This gives us a good adequate timing response, if you will, to know if that patient can receive TPA or if they're still in the window for us to intervene or not. This, what you see behind me, is the interventional suite itself. I'll have you come in. As you can see, it's a little bit more involved than the original angio suite we were standing in. Not only does it have this biplane x-ray, but it also has this overarching x-ray that can spin 3D while we can look at patients' brains in our minimally invasive procedures. Our minimally invasive procedures take about 3 to 4 hours, whereas in the past, to do them in the operating room would have taken about 10. The most important thing to remember when you're sending a patient to one of these procedures is their labs. You'll need current labs on this patient, coagulation, if they want anything special for Plavix and aspirin, platelet level, as well as creatinine level. They can be on blood thinners going to this procedure. In fact, our neurosurgeons would prefer that. After these procedures, they typically go back to the ICU. Thank you for visiting us on this little tour of the Neurointerventional Radiology Department. Hello, my name is Marie, and we are here at the Baylor St. Luke's MRI department, which stands for Magnetic Resonance Imaging. And the way the MRI machine works is you lay in a long tunnel that sends magnetic pulses through your body. Those magnetic pulses knock your electrons off course at the atomic level, and then the pulses stop. The time that it takes that energy in your electrons to return to normal will convey images back to our machine, and we get really specific, detailed images of body structure. So that's what we typically use MRIs for, is detailed images of structure. There's 2 main considerations to think about when you're sending a patient to MRI. The first is claustrophobia. An MRI resembles a coffin, a really noisy coffin. Most people don't know they're claustrophobic until they try and go in through an MRI machine. So if your patient has any indications of claustrophobia or thinks they can't handle it, ideally we'd like them to have anti-anxiety medicine up on the floor before trying to send them down to us. The second indication is, of course, the number 1 contraindication for an MRI scan, and that is metal. Metal anywhere in the body or on the body itself. So examples of metal in the body include things like a pacemaker, heart valves, electronic heart valves, screws, plates, rods in the limbs. If you've got an aneurysm clip, a deep brain stimulator, any type of implanted pump. Some tattoos have metallic fragments on them, bullets, shrapnel, BBs, implants of any kind. All of those are examples of metal in the body. Metal on the body includes things like jewelry, or I'm trying to think, your pens, watches, hair ties, hair clips, or in a nurse case, things like oxygen tanks or IV pumps or poles. All of those things can be metal that we will need to clear our patient for before coming down into the MRI scan. Typically, before you can even send your patient to MRI, you need to fill out an MRI safety form. Those used to be forms that you faxed to the department. However, they are now available on Epic, and you can fill them out. The techs will be able to see it. They will also need to come down on a specific MRI stretcher. There's no radiation involved in MRI, just the magnetic part. Now, why I'm standing in front of this gigantic door is, of course, because I can't film inside the MRI suite. MRIs are strong enough to wipe phones and credit cards. So this wood door is how most people know that they're getting close to MRI. If you're coming from the yellow elevators, you'll come down to the basement, come in through one of those back doors over here, come down this hallway where you'll see this wood door. For purple elevators, you can come in through this way, but it's honestly almost easier to come all the way around the department, come in through the back door, and come to the wood. And we're gonna walk down the hallway together until we get to the actual MRI department. Another thing to remember too is that it's easiest if you clear the patient of metal before bringing them down to the MRI suite. That means moving all dentures, jewelry, hearing aids, glasses, and even things like electrodes. Down over here is the MRI suite itself. You'll need to call to get in if you're an ICU nurse, or if you're a floor nurse just dropping your patient off. And there is a phone over here on the wall. Thank you very much. Welcome to the Cardiovascular Nuclear Medicine Department here at Baylor St. Luke's Medical Center. So to be clear, there are two different nuclear medicine departments here at Baylor St. Luke's. I am in the more common one on the 3rd floor purple elevators. That's how you get here. 3rd floor purple elevators all the way in the back. The 26th floor nuclear medicine does other scans that kind of operate the same way. And the way these machines work is we inject the patients with a radioactive tracer. That tracer goes to different places in the body and we can see metabolism. Best example of this is an infection scan where we attach that tracer to sugar, and bacteria love to eat sugar. Wherever the most sugar is being taken up is the source of the infection in the body, which is kind of cool. But the real reason why I'm standing here is to talk about cardiac stress tests, which a lot of our patients go through in the hospital. So the way a stress test works is we will take a series of resting images of the heart while the patient's at rest, typically lying down. And then a nurse like myself will give a medicine called regadenoson. It's a cousin of adenosine. Causes the heart to feel like it's working out. So the patient may feel chest pain, shortness of breath, headaches, flushing, nausea, vomiting, abdominal cramping, etc. Those symptoms last for about 3 minutes and then they go away. If they don't go away, I can give them an antidote for it. This test is 85% accurate at determining whether or not chest pain is coming from the heart's coronary arteries or not, and it helps determine if the patient is going to the cath lab. So let me go ahead and show you the pictures that we get when a patient has this test, and they're up over here on the wall. So you can kind of see from that far away, each of these images across here correspond to the 3 coronary arteries. These are the most normal. These down here would be examples of coronary artery disease, a blockage that could result in stents or potentially bypass surgery. And I believe we'll zoom in again. One of the most important things to do about this test, since it is so critical, is the prep for it, and that's what I will go over now. For this particular test, we'd like the patient to have nothing to eat or drink for about 4 hours prior to the exam. The reason is so that they don't throw up during the stress portion. We would also like them to not have blood pressure medicine like beta blockers before the exam, so only beta blockers, because beta blockers decrease the heart rate. We need their heart rate to go higher under stress. Going along with the nothing to eat or drink, no caffeine for 12 hours prior to the exam. The reason for that is caffeine is actually the antidote to the medicine I'm giving them. So if they have caffeine beforehand, my medicine won't do anything to them. So caffeine includes things like coffee, decaf coffee, tea, energy drinks, soft drinks, and chocolate. This department is only open from 8:30 to 5 each day. So if they have caffeine today, they won't be stressed until the next day. So keep that in mind. Please don't give them caffeine. The last and most critical thing to remember is that if this patient came in chest pain and they are still actively having chest pain, please do not send them to me. Reason being, my test creates more chest pain. I will not be able to tell if the new chest pain that they're having is worse than they've had prior or not. And if the indication itself for this test is chest pain, I will need 2 negative troponin tests before I will consider stressing them. As always, if you are an ICU nurse, you will need to accompany your patient for this test. And one of the reasons why that's important is there's actually 3 different types of tests. One is a 4-hour version, one is the treadmill version, which I'm pretty sure you're all familiar with. You get on a treadmill, you run until you reach your maximum heart rate. But the most common are 2 chemical ones. So let me go over the 4-hour version first. It's called SPECT or MEDI. And it has to do with this machine over here in the corner. So what happens in this scan is the patient will come into the department, lay on this, be injected with a radioactive tracer, they wait an hour, then they'll go onto this machine for about 10 minutes. Then they'll come back to this stretcher. I will give them the stress medicine. We will stress the heart for a total of 6 minutes. They'll wait another hour, go back on the camera for pictures, and then they're through. So that would be the 4-hour version of the stress test. The other version is called PET scan. It's behind this wall over here. And all it is, they lay flat on their back for about a half an hour. And we do resting and stressing images at the same time that I'm physically giving the medicine to them. So, just so you know, those are the 3 types of stress tests at Baylor St. Luke's. And you should also know that we typically don't do the 4-hour version on the weekends. On the weekends, this department is on call. So on the weekends, we typically like to do PETs. And thank you for watching this video.